Hello, everyone. My name is Asma Khalil, and I'm a professor of maternal fetal medicine. I work at St. George's Hospital in London. I'm also a vice president for academia and strategy at the Royal College of Obstetricians and Gynecologists. And I'm here with Associate Professor Matthew Chico from the London School of Hygiene and Tropical Medicine. And we're here to talk to you about a very exciting opportunity. So, Matthew, do you want to tell me why you choose to work on reproductive health, and tell me about your research journey?
I'm a clinical epidemiologist. I've been working in this space for the last 25 years in different research settings. But the real interest I have is in improving our packages of care that are delivered to, in particular, pregnant women in low and middle income countries. And we work within the kind of constructs of and recommendations of the World Health Organization, trying to generate new knowledge that advances the recommendations coming from the WHO. WHO is not a research entity. Rather, they play a very important role in convening experts on particular topics, so that they then can make recommendations about what particular guidelines should contain. And so my research focus has been really trying to reduce the burden of malaria in pregnancy, reproductive tract infections in pregnancy. This kind of has multiple implications. You're trying to improve the care of the mother to the extent prior to conception, through conception, and then recognizing that it's the child, the newborn, having the best opportunity in the early neonatal and the infant year. That's when risk is greatest, and so my attention is really focused on that. And in fact, that's where this particular research project is kind of nested. We've got two very large clinical trials that have recently ended. We have the clinical data from them in terms of antenatal care that was administered and the birth outcomes. And we have biological samples, vaginal swabs, stool samples, so that we can look at the intestinal and vaginal microbiome. Knowing the birth outcomes and designing studies to better understand why a woman and why a child underwent a successful gestation, and why it didn't, in instances where it didn't result in a positive birth outcome, so that we can address those better. It's really understanding the mechanisms at play. Yeah.
So this is, this opportunity is a collaboration between the London School of Hygiene and Tropical Medicine and St. George's Hospital.
Yes.
Provides this PhD opportunity. So if I'm a researcher and
Yes.
come across this opportunity, tell me why I would apply to this opportunity?
I would think it would be an easy question to answer, but of course you need to have the facts. And when you feel as though you're working with people who are at the leading edge of knowledge itself, and really working at the forefront of science and discovery, you yourself have a great deal to gain and to learn. And in fact, that is very much what we're doing ourselves. So the partnership and this opportunity brings together London School and St. George's, clearly, and our partners extend to at least 3 other institutions within the UK that were involved in those 2 clinical trials. We have UCL, Imperial, and the Liverpool School of Tropical Medicine and Hygiene, simply because they were part of the clinical trials. And then we have partners overseas as well, in Kenya, Tanzania, Malawi, and Zambia. So through this, a PhD student would have the opportunity to work under the mentorship of London School and St. George's, with additional and important guidance and mentoring that would come from and input that would come from these partner institutions. It really is a rich opportunity to learn in really in-depth ways that will advance our knowledge about pregnancy and improving pregnancy outcomes.
That sounds exciting, but of course it's also competitive. So what skills and experience would you look for, or would you expect in a successful candidate?
Yes, that's really, really important. And I think so there are academic skills, there are personal skills. Academic skills, one should have a good grounding in laboratory science, because really what we're looking at in trying to understand better the barriers, the biological mechanisms by which adverse pregnancy outcomes occur or do not occur. We're looking at really the laboratory side of this with microbiome analyses and learning metagenomics and so on, the methods there. Obviously, an inclination for statistical analyses is obviously to one's advantage. These are kind of the inclinations, the larger skills, if you will, that you would want to bring to this. But I do think that persistence and curiosity are probably as important, because those are the skills that will drive the questions. Because when you answer a question, you raise another question. This is what discovery is, what it's all about. It's remarkably motivating. But if your curiosity leads you to the next question and the next question, you'll really be pushing at the forefront of our knowledge in this space. So I think there's the academic skills that you bring and the personal skills, persistence, one's attention to detail. Because there are a lot of partners, you probably want to be a flexible person as well, to the extent that that's possible. We're reliant on multiple institutions providing data. We already have the samples in biobank, so that's all set. But anyway, I think it's a combination of a background that we're looking for, and I hope people are drawn to it, because it's a real growth opportunity.
And finally, just to really highlight that, of course, there's no person who's perfect, and certainly
right.
someone who is a really good candidate, but lacks some of this, the research skills. This is where the opportunity to acquire some of the research skills, and certainly the London School of Hygiene and Tropical Medicine is probably one of the best institutions to providing a number of taught modules that can really equip the candidate with fantastic research skills that are not just relevant to this PhD or this project, but also to the long-term academic career. So I really hope that in this very short video that we shared with you really exciting opportunity and very important project that hopefully will make difference to women and babies' lives. And on this note, I'd like to really thank Matthew for being here with me in this video, and just to reach out to people and say, look, if you are interested, please feel free to get in touch with us if you have any questions or if you want to discuss that further, and we look forward to working with you.
Great. Thank you so much, Asma. And we look forward to your interest.